Life is designed to be lived to the fullest, celebrated each day and each moment cherished. Welcome to Celebrations Health reBalance. I am your host, Dr. Charles Hleza, and we are here today to still continue to discuss about celebrations, looking at all the different letters in celebrations as far as non-communicable diseases are concerned. And I've got a special guest today who's going to help us to discuss these particular challenges that people face in life and how celebrations can play a pivotal role for better management of non-communicable diseases. Welcome, Dr. Linz.
Hello. Thank you so much for having me.
Okay. Thank you for coming to the program. Can you please introduce yourself to our viewers?
My name is Dr. Jera. I'm a senior medical resident officer at one of the central hospitals in Harare.
Okay, thank you so much. So today we want to look at non-communicable diseases. Would you mind to give our viewers a definition of what non-communicable diseases are?
So, simply to put it, a non-communicable disease is a disease that cannot be spread directly, like an infectious disease. So this one is a non-infectious disease that mostly we get because of our lifestyle. That's why we're here to discuss how lifestyle or how celebrations can affect these non-communicable diseases.
So you have just brought in another term there. You said infectious diseases, non-communicable diseases. So maybe if you can give an example of an infectious disease so that people can differentiate from a non-communicable disease, and then probably give us also an example of a non-communicable disease.
All right. So a communicable disease or an infectious disease would be one like typhoid, one that I can get from being in direct contact with maybe stew. Right, so it's mostly transferred via the fecal oral route if it's in the case of typhoid. And then a non-communicable disease is one that cannot be spread through contact. An example would be diabetes, heart failure. I cannot say, oh, I sat in a combi with someone with diabetes, now I have it. Unlike maybe TB, where if I sit with someone who is coughing, I can get it. I can catch it.
Okay, no, that's fine. So now, I'm just looking at the word non-communicable. And to me, it's almost like speaking to something. Non, which means not. Then communicable, communication. So there is no communication between two people as far as that disease is concerned. And then the infectious one. In layman terms and quotation marks, can I say it's a communicable disease?
Yes, there's some sort of communication, right, between you and the other person, whether it's through the air, whether it's through skin contact, or it's through things like fomites, like sharing towels, and things like that.
Okay, yeah, I've come across the term chronic disease. Is there a relation between chronic and non-communicable, or they're two different words?
Okay, so sometimes you get infectious diseases that are chronic or have a chronic picture, right? And then sometimes you get non-infectious diseases or these non-communicable diseases that are chronic. So you find most often at times these non-communicable diseases are chronic conditions, right? But that does not mean that the communicable diseases cannot also be chronic. I don't know if I'm making sense. To say maybe someone can have TB for years, right? It's chronic, but it's an infectious disease. And then someone can have diabetes for years. It's non-communicable, it's non-infectious, but it's also chronic.
Okay. So munhu kana karwara nechirwere kwenguva yakareba takuti that's chronic.
That's chronic.
Yeah, whether it's an infectious disease or whether it's a non-infectious. Okay, no, that's fine. Thank you. So if we are looking at communicable diseases, no, we're not looking at non-communicable diseases in Zimbabwe. What are the numbers like? As far as kuti vanhu vari kurwara you gave an example of diabetes, hypertension, most of these common non-communicable diseases. Zvanyanyopfumbira zvakanyanya here, or the numbers is not really something to be concerned about.
All right, it's something to be definitely concerned about. So the numbers keep growing, and initially you would find that these non-communicable diseases were found in the older generations, the people who are above 40 and going upwards. But now the numbers have actually been growing in the younger generation. So you find that we've got more people with diabetes, we've got more people with heart failure, we've got even increasing rates of people with cancers, right? So the numbers are fast growing. You know, we used to worry only about malaria, we're worried about HIV, TB,
Okay.
but now we're finding more and more numbers in the non-communicable group of diseases.
Yeah, there's an article I read during the week. I think it's coming from one of the hospitals in Manicaland, and the doctor in charge there was discussing about how the non-communicable diseases are actually on the rise, and it seemed as if he was pointing out to the challenge of our people here in Zimbabwe. I don't know about Harare, because this is coming from Manicaland. It looks like people are not keen to visit hospital facilities, clinics, doctors for checkups, and they usually present late and probably with complications, or when they probably realize that, hey, I can't function as I used to. Is it the same here in Harare, or it's different?
Late presentation of patients is everywhere. It's the same even
Okay.
in Harare. You find that there's what we call disease progression. So in the initial stages of disease, patients just sort of brush it off and
Okay.
think, oh, it doesn't matter, why present now? Most of them is because they're unaware that the disease process has started. So they don't come forth to say, no, I've got this symptom and that symptom. They only come to present later on. And sometimes patients don't think it's actually a symptom.
Okay.
They think, it will what, I'll get over it if I just use over-the-counter medications for some time. And then they present maybe 10 years down the line. So we've got what I want to call poor health-seeking behavior
Okay.
as maybe youth, and we think, the hospitals are for older people. I'll think to myself, why would I get diabetes when I'm this young? Why would I get hypertension when I'm this young? So I don't get those regular checkups, just to go to the doctor for a checkup. I'm not sick. I don't have any symptom, but a regular checkup.
Okay.
Even the dentist. We don't visit the dentist as often as we should because we don't think it's important and we
Okay.
don't think would be affected.
All right. Now, let's get into the disease process. We want to look at, in general, the disease process as far as non-communicable diseases are concerned. You may choose an example if you want to. Of course, later on, as we have got more programs, we're going to get into the single non-communicable diseases. But today, if you can help us to understand the disease process as far as non-communicable diseases are concerned.
All right. So for most of the non-communicable diseases, we've got a pre-disease stage
Okay.
where one has the disease, but they have no symptoms.
Okay.
So outwardly, we don't see anything. They are, what I would say in quotes, healthy, and they're fit, and everything is as normal on the outside. Yet inside, the disease process has already started. If it's maybe someone with diabetes, their cells are already not responding the way they're supposed to be responding to insulin.
Okay.
If it's heart failure, right? Maybe their heart valves are not working as they should be, so it's starting bit by bit, just wreaking havoc within, and we can't see anything outside. Like maybe if it's a tumor, right? The cells have already started multiplying slowly, yet we don't see a lump on the outside, and the patient's seemingly fine. So that's the pre-disease
Okay.
stage, or the pre-symptom.
Okay,
Stage.
pre-disease. Almost kunge munhu adyara chibage.
Yes.
Kwanaya tikatarisa munhu hapana chatiri kuona.
You see nothing.
But the seed is what? Is
It's
actually
there, it's inside.
germinating. Kakutozobuda kashizha takutokaona.
Tatonata, there was something there.
And probably by that time, the maize is growing. Or probably in another angle, munhu atorima chibage chake. But my seeds a blackjack mtsine adona pangarudyara hana kumaona. but ari kutogerminate.
Yeah.
By the time they realize that they are there, probably zvatokomba. Is that a better example
That
of
is
a
a
pre?
good analogy.
Okay, no,
It's
that's
a
fine.
good
Thank
analogy.
you. Yeah, you may proceed.
So that's the pre-symptom stage. And then the following stage would be where the patient now develops symptoms.
Okay.
Right. So when they develop symptoms, you can see that there's a disease process happening. Right. So you find that in most of these communicable diseases, the non-communicable, in most non-communicable diseases, the symptoms are gradual. They develop gradually. So you find that a patient might start out with maybe just a single symptom that does not directly point towards a specific disease. Right? So these are called early symptoms.
Okay.
Right? So we've got those early symptoms, and this is early stage disease. In someone maybe with cancer, they would have maybe weight loss, right?
Okay.
And it's not too much weight loss. It's something that you could say, I'm losing a bit of weight. And if it's someone who exercises, they'll be just like, I've been working out these days and I'm losing a bit of weight,
yeah.
right? If it's someone maybe with diabetes, which say, no, I have increased thirst, and they'll be like, masana kuri kupisa, So these are the early symptoms,
Okay.
the telltale signs, that you can't really pinpoint to say this is the certain disease. Yeah.
Okay.
And then there is the late symptoms now. Right. After the early symptoms, we have the late symptoms, where now most of the symptoms of the disease are now coming out. You can now actually see them. You can actually see that, they planted maize, there's now maize there. So in these late symptoms, most of the times it's now a syndrome or a group of of symptoms that are coming out all at once. So you find in someone maybe with heart failure, they now have shortness of breath. Maybe initially it was just shortness of breath while they were walking maybe 50 meters. And now, even at rest, when they're seated, they have shortness of breath. And they start to tell you, I can't even sleep at night. I have to wake up gasping for air, And they tell you, once in a while, my legs start to swell. So now it's no longer just one symptom pointing towards disease. There are now a lot more symptoms. So you find sometimes when you plant maize, you find panezolotanga kumira. Those are the early stages. And then you find, 2 weeks later, the whole field is filled with what? With maize crops. So that's late, right? So then after that late stage of disease, there's now, I don't want to call it later, but this is the stage where the patients now present with the complications of the disease.
Okay.
Right. To say what you were saying earlier, someone has planted maize and pazoita mzine. Yeah. So now it's late. Right.
Okay.
You find that in people with diabetes, you find some present, they can't see. Something's wrong with their vision, and then some present with foot ulcers that are not healing.
Okay.
So now these are now complications of disease.
So on the examples of non-communicable diseases in Zimbabwe, or rather let's limit it to the place where you're working at, which one are people most affected with?
I've seen a lot of diabetes, type 2, and there's also hypertension. I've seen a lot of hypertension. So those two are number 1 and number 2. And then we also get various types of cancers, right? And then heart failure as well.
Heart failure.
So those are the top 4,
Okay.
I would say.
All right. No, thank you for that. So looking at these top 4, which ones would you say the youth are being affected by more, or probably the adults also are being affected more by, if you can compare the two?
All right. So in young patients mostly, surprisingly, we're seeing a lot of diabetes.
Okay.
In young patients, right? And there's this subtopic, if I remember well, in medical school, we would say diabetes in the young, right? And because it was special, and it was allocated a small corner in the book because it's a small topic, not a lot of people are affected, but we're seeing more and more of it, right? And then you find yourself having to go back into research to say, what is this diabetes in the young? And then we're also seeing hypertension And we don't see hypertension as hypertension when the patients present. We're seeing it as strokes in young patients. And then you're now trying to look at what is the risk factor for this stroke in this young patient. And you find, oh, they've got hypertension.
Okay.
And then you make a diagnosis of hypertension in a stroke patient. Yeah.
Okay. Then what about the adults?
Adults, so we see a lot of diabetes in the elderly, and most of these present with complications.
Okay.
Yes, and we also see a lot of hypertension in the adults. I think with the cancers, it's neither here nor there.
Okay.
Where I am currently, you see it in the young, you also see it in the aged.
Okay.
What we maybe draw a line is the type of the cancers that we see.
Okay.
Right. So different types, different age groups.
Okay.
Yeah.
Now, looking at the two age groups, you mentioned that now there is more of the youth being affected, unlike before. What would you think, or what have you been observing to be some of the probably causatives, should I put it that way, or maybe risk factors, or what's contributing to such development?
I think mostly it's lifestyle.
Okay.
If you look at the people who present, if you just start by looking at the lifestyle choices, you find most of them are on the other side. What I would say, poor lifestyle choices.
Okay.
While if you find it in the elderly, the lifestyle was a bit better as they were younger, and now they're presenting later on in life when the disease has progressed, but the progression is not as fast as in this young generation. So you find most of the times the differences is in the lifestyle.
Okay, thank you for mentioning the word choice, because then this leads us to celebrations. And the first letter on celebrations is C, which is choices. What role does choice play when it comes to non-communicable diseases?
All right, so choices have a lot to play, a long way to go in terms of non-communicable diseases, which we also call lifestyle diseases. So you find that that which we choose to eat, that which we choose to spend our time doing in terms of exercising, the company we choose to be in, the choice of what we drink, the choice of how we seek health, our health-seeking behaviors, all those choices are going to come into play, right? So if you find there's this war that we're trying to fight, this pandemic, so to speak, about drugs and drug awareness, you find that most of our youth are involved in either drugs or substance abuse, and these are risk factors for some of these diseases.
Okay.
You know, smoking is a risk factor for many cancers, as well as taking alcohol, right? You find that you'd find it rarely where you'd have women who'd take alcohol. When my grandmother was still alive,
Okay.
it was a taboo. But now, more women
Yes,
are taking alcohol, meaning we've increased the risk factor for whatever cancers that are there and that are maybe worsened by taking alcohol. And it's a choice to say, I take alcohol, or oh, I don't take alcohol. And then there's disease processes that are affected by our weight. So you find that we group people. We say there are people who are underweight, there are people who have a normal weight, there are people who are overweight, there are people who are obese, right? So we choose to say, I don't exercise and I want to be a plus size or a minus size. You know, we basically can choose that. It's within our control, right? So when you choose to say, I'm okay, obese as I am, it means you're also choosing other lifestyle diseases
okay.
like diabetes. You know, so this is all what? This is all choices. If you choose it, no, I don't like to sleep early. I like to sleep after the wee hours of the night, you know, and we know that bipolar, right, worsens the mental health condition. That's a non-communicable disease that worsens when someone doesn't get enough sleep. It means you're choosing that route.
Okay.
Yeah.
Yeah. Now, looking at these choices, I'm going to go to in choice,
Okay.
because ndezvekumhuri kwedu ndakangozvarwawo sekuru, mbuya, baba, tete, bankuru, ndo dambudziko ringoripo, saka ina handina choice. Ndakangozvarwawo ndakangodaro. Is that 100% true?
No, it's not 100% true. And that's the fortunate thing about it, you know.
Okay.
To say, I have a friend who puts it this way. To say genetics, that is, in simple terms, where we're coming from, where you're born, right, is like a gun, right? And then lifestyle is the trigger, right? So genetics sort of loads the gun. But someone has to pull the trigger. So you find that there's a certain picture of a celebrity that I like. He's got 2 sons. So
Okay.
he is into fitness, and when he separated with the wife, he took 1 son, right? And then the wife took the other son. So he's into fitness, and the son that who he was living with also got into fitness. And he has this good physique, healthy, and he has a normal body weight. And then the other son with the mom is what we would call obese.
Okay.
Why? Because of the lifestyle. These people have the same genes. So I was recently reading about these 2 brothers, and one of them has pre-diabetes. You know?
Okay.
So in my mind, I'm like, oh, so genetically, these people may be genetically predisposed to having diabetes. But this other one now pulled the trigger. Why? Lifestyle, the choices that they've been making.
Okay. Now, looking at the patients that you have come across, when you start discussing with them about choices, which I'm assuming you do, now, how easy is it for people to accept that apart from taking maybe the medication you have prescribed for them, which they're going to buy from the pharmacy, and they're actually going to make a choice to say, I'm going to choose to go and buy. They're going to make a choice to take as instructed by the doctor. But when you're talking about other factors outside of that, how easy is it to discuss that with patients?
It's very difficult. It's very difficult to discuss with patients, because patients, most of the time, do not want to change how they live. I would actually zero it to myself. It's difficult to change the way I've been living. It's what I'm used to. It's the norm. So that discussion is not really going to come into play in my mind. I could discuss it with my doctor, but at the back of my mind, I'm like, no. And because we haven't been speaking as much about the other adjuncts to the medical interventions that are there, the patients are not really aware that,
Okay.
in addition to the medication that I've gotten, I should also do A, B, C, D in terms of my choices,
Okay.
right? So that I get better. What they're used to is, I take this and that from my prescription. That has nothing to do with outside of medicine, and I'll be well. You know, so they don't know, they're unaware. So I think the more we talk about it and people become aware to say, if you've got diabetes, it's not just about insulin injections, it's not just about the drugs that I'm going to take, it's also about the choices that I'm going to make in terms of what I'm going to eat, what I'm going to put on the table, or what I'm not going to put on the table.
And if there's anything that is constant, it's change. Change is constant. If there is anything that is always going to be happening, it's learning. But the question comes to, when does one prefer to learn? Do they prefer to learn in the consultation room with a doctor maybe for 5, 10, 15 minutes and accept it? Or they wait for an emergency? They wait for a bigger challenge to then learn it the hard way. You know, my daughter is 2, and I grew up when it's time to eat sadza. That's for us who are from Midlands, you know.
Yeah.
And so my wife is the opposite.
Oh, okay.
They don't do this from Mikaland. They just take the sadza and into the relish and done. So my daughter looks at me when we're eating sadza. Say, Daddy, so why are you doing this? Are you still trying to cook the salsa? She's trying to understand. So sometimes I try, okay, let me try not to do this. But I find myself doing it. It's like a habit that I've developed over the years. So if there is anything challenging, should I put it that way, to implement, is change. but change
Definitely.
is constant. So in your practice, have you come across people who then say, look, it's either I am in or I'm out, and they decide to make a change? And have you seen any results out of the changes they've made?
Yes, I have seen results. So there are patients who've decided to take a 180, to totally change, to take what you're saying at face value. And I have seen results. I've seen things start to change for those patients. And they do testify that it's difficult. Some of them come and say, "Oh, I've changed this time, but I haven't changed that. I'm still struggling with it." To say maybe it's a patient with hypertension, and they're saying, Chiremba, inini, I like my salt. I love my salt, and
The choice on salt.
I can't do yeah. And
Yeah.
then they make a conscious decision to say, "Oh, I'm not going to add any salt to the food that I'm being served. Whatever it is that's set before me, I'm going to reduce the salt." And you find the blood pressures reducing drastically. And some of them say, Chiremba, I know you said if I lose a bit of weight, my hypertension will get better. I've been trying, but it's difficult. But the salt I've conquered. And then you find someone coming in and say, "Oh, Chiremba, I've been exercising. And please look at my sugar readings for the past month and a half." And you also find, okay, the sugars are starting to come down. And like, Chidemba, I think I've started having small grains, and I'm not having super ultra processed foods. Please look at my sugar readings. And you actually find, they're lower than they were before. And when it's time to do maybe an HbA1c, it's a test that you do after 3 months to just check the patient's glycemic control. You actually see, it has come down. And those patients are so happy such that they start to spread the word now.
Okay.
To fellow patients to say, I've tried this and it works. And they're even more motivated to change. So results motivate people to change.
Okay.
To say, let me
Now,
change.
so, Doc, are you saying in a hospital environment, because I understand you work in a hospital environment, a big hospital, not these other small hospitals, are you saying there's room for doctors to discuss with their patients about choices? You mentioned salt, you mentioned weight, you mentioned exercise, you mentioned small grains, as far as choices are concerned. So you're saying there's room to inform patients about this?
Yes, there is room. Maybe because the doctor-patient ratio is a bit high, we might not spend as much time discussing it as we would like, but we try on visits, subsequent visits, to discuss the changes that a patient can make or the choices they can make depending on their disease process. Sometimes we set up special clinics to say this is going to be a clinic for this specific condition, such that patients get education about the certain diseases that they have. And sometimes before any clinic starts or before you review patients that you've seen before, we've got other healthcare professionals who talk to patients to say, this is your disease process, this is how it affects you, you can do A, B, C, Ds. And it's been helping. It's been helping. Yeah.
Okay, thank you so much for that. Vatereri, you have heard it from our doctor that in one of the big hospitals, there is room to discuss with the doctor about certain choices as far as lifestyle is concerned. And this is very empowering. This is encouraging. So when you visit your doctor, in the few minutes you have, ask them, what else can I do as far as the choices apart from the prescription that the doctor has written? And they can drop 1 or 2 or 3 that you can start working on. And as you have heard from her, people then begin to implement this and results begin to come. Now let's talk about exercise.
Yes.
Looking at exercise, is there a relation or a connection with non-communicable diseases?
So there is a connection between non-communicable diseases and exercise. And the big one these days is diabetes. Obviously.
Diabetes.
Yes. So in the disease process, right, there are certain stages whereby if you implement exercise, the disease actually sort of goes into remission or sort of halts the disease process. So what happens is...
Okay, Doc, before you go further, you mentioned remission, you mentioned halt.
So remission is when the patient still has the disease, but you don't have the symptoms of the disease, right? Yeah. And then when we say a halt, it's like there's no further damage that is occurring because of the disease. Yambomira kurudunuka.
Okay.
Right. You know how we say a stitch in time saves nine. So that's exercise for you. That's the stitch in time. Right. So you find that when we speak of exercise, we're mostly speaking about weight and weight management. So you find in many non-communicable diseases, if you manage your weight, you'll be able to halt the disease process, or you'll be able to manage the symptoms such that you can get into remission. So a patient with a BMI is, in simple terms, your weight against your height, right? Someone with a BMI that puts them in a range of obese is different from someone who has a BMI which puts them in a range of overweight. The disease process is going to be different. Even the symptomatology is going to be different, and the rate of progression of disease is going to be different. So if someone exercises, right, it's going to aid their whole system, right, in processing their insulin. I'm not going to speak about the intricate details of it, but it does help to reduce weight. And sometimes you find if you lose about 10 to 15% of your initial body weight when the diagnosis of diabetes was made, right, over the next maybe 6 months or so, you find that your HbA1c, your glycemic control becomes even way better.
Okay.
And you find for those patients with non-communicable diseases like arthritis, right, it's because of the weight that is on their joint. So if you unload the joint, right, the pain becomes better. So unloading the joint, how do you do that? You reduce the weight on the joint. And one of the ways to do that is by exercise. And exercise encourages mobility, not just mobility of the whole body, but even in the joints. And it sort of stimulates production of the fluids, synovial fluids in the joints, right? Meaning that you also get to relieve the pain, and you sort of lubricate the machinery in the joints, meaning you get sort of like a relief of your of your arthritis. And this is the beauty of of exercise.
Okay, muri papa chiremba omwana gona kuti ani ari kurwadziwa my joints because of this arthritis, and they still want to be active. What's the best advice you can give our audience for someone like that?
All right. So exercises come in a range. They're different. They're aerobics, and then there's cardio. There's a lot, right? So you need to find an exercise that is specific for your condition. Is it cardio? Is it high intensity? What sort of exercises should I do? But what I realized across the board is if we all start by brisk walking, would do our joints, would do our bodies a huge favor. So my advice is start moving. Start slow. So start slow. How? By walking. If you do 30 minutes for 3 days in a week, that's seemingly slow, but it gets you far in terms of exercise.
Okay. Wonderful. Thank you so much for that. Now, still on exercise, as far as non-communicable diseases are concerned, I understand in our country these days there's a hype about marathons, going to the gym, exercising with a coach, etc. In comparison with other lifestyle factors on celebrations, exercise riyanganetsavanyire mazuva ano kana kuti zvaanani kana ndizvongoonawo pamaflyer nepa-TV nekumwe, but in reality vanhu havasi kunyatsoshandisa miviri yavo.
Right. I think it has gotten better. It has gotten better because of the social media hype, Yeah, but it's not where we are supposed to be. It could get even better. You'll find that in the younger generation, it's better. People want to be active, they want to be about. They're the ones who are joining these marathons. In the older generation, it's inini ndagara nenda kumunda, so I'm exercising. Or ndagara ndochera mvura pamugodi, so I'm exercising. So they haven't gotten what we mean by exercise, you know. And when I was watching one of the episodes from this show, I'm like, everybody needs to watch this about exercise so that we know what exercise is. Yeah.
Okay. No, thank you so much, Doc, for that. Now, let's get into liquids. I want to talk about liquids and how they affect the disease process, primarily looking at the disease process when we're looking at liquids. Do you want to expound more on that?
All right. So our liquids come in various types. Yeah. So the best beverage, as was said earlier on this show, is water. Right. So you find that water is like oil to this fine machinery, the human body. Right. So you find that the water that we take in, if we take it in adequately and we take it in at the specified times that we're supposed to be taking water in, it will help with our kidney function, right? It also help with our heart and mental health as well. So you find that the human machinery is not just independent systems. No, they all work together and they work in sync. Right, so you find the heart is going to be working hand in hand with the kidneys. So if the kidneys are not well, right, say you've developed dehydration because you're not drinking enough water, now you've got kidney stones. It means your heart is going to then be affected because they work hand in hand. So the quality of the human machinery is going to be affected by the type of the fluids that you're going to take. An example being water. Another one would be alcohol. So this one is a big one, right? So you find...
Maybe, Chiremba, before you move to alcohol, tichiri pamvura, the best beverage. Pakuona kwamunoita varwere zviri kuratidzira kuti vanhu vari kumwa mvura here munyika vanouya kana kuti people really are not drinking much water.
Yeah, people really are not drinking much water. People are drinking everything else other than water.
Okay.
Right. So you find our patients, they come in with maybe they're involved in an accident, or they just have a cough, or they've got things that are not seemingly water related. They've got maybe a cancer, or they've got heart failure, or whatever it is that they have. And then you want to just check their baseline kidney function. Maybe they're required to go to theater for whatever condition they have. And now when you want to check their kidney function, you find out, their kidneys are not functioning optimally, right? And for some of them, there's what we call an acute kidney injury, and fluid fixes that. So now we know, they've got a bit of dehydration. Why? Because they're not taking water. And some of them, if you just give free fluid, right, your water by mouth, the kidney function comes back to normal. So people are not drinking as much water as they should. Yeah.
In discussion with some of them, what are some of the reasons they would give maybe for not taking in as much water as they should?
Most of the people that I've talked to think that there's hidden water in other beverages. So if I'm taking my ale, I'm taking water. If I'm taking juice, I'm taking water, right?
Okay.
So in the juices that they're taking and the teas that they're taking, they think they're taking water. So in their mind, they think, I drink 2 liters of water a day.
I see. Okay. Now you may proceed to alcohol.
So what I remember as a student, right, if I didn't know the answer when it comes to risk factors for disease process, I would just say alcohol. Yeah, so I would say number 1, obesity. Number 2, alcohol. Number 3, smoking. Yeah, I my answer I should have thought of, But apparently they were always correct. Almost 99% of the time they were correct, right? So you find that alcohol is a risk factor for many disease processes, or it can actually be a cause of a non-communicable disease. There's a special type of disease. It's a mental health condition that's called substance-induced psychosis. One of the substances that can actually cause it is alcohol. So we've got a subgroup of that disease that's called alcohol-induced psychosis. right? So it's actually a disease process that's being caused by the alcohol, and alcohol worsens some of these disease processes. Alcohol worsens your heart failure. Alcohol worsens your kidney function. Remember, we say alcohol is a stealer, it's a thief of water, right? So it causes what your dehydration. So already, if your kidney function is not optimal, and you're taking alcohol, then it means it's going to impede your kidney function, and also it makes other conditions worse, or it impedes healing, right? So you find alcohol be the basis of most of these non-communicable diseases is inflammation, right? And you find that alcohol promotes inflammation. So whatever promotes inflammation, right, is going to promote the disease process. And sometimes you find that as the body tries to detoxify itself or clear itself or clear the blood, the liver is involved, the kidneys are involved, and this alcohol is going to affect your liver, right? And you're someone maybe who already is predisposed to diabetes. It means you are pulling the trigger on those genetics. Why? Because of the choice that you're making of taking a certain liquid. So when it comes to liquids,
Okay, so alcohol is a thief, a stealer. Chainongoba chet imvura. Ndozotaura chiremba. So pamuchafunga kuti nguva yeholiday, vanhu vachamboda kumbofara kana kuti nguva yeNew Year, hapana anoda kubirwa zvinhu zvanenge akachengetera kuzofara nazvo
for sure.
paChristmas kana paNew Year, or even kubirwa anytime. But out of ignorance and maybe lack of knowledge, some are willingly taking in a thief.
And that's just the tip of it.
The tip of it.
It takes away more than just the liquid from your body. It's more than just a dehydrator. So if it's stealing just a bit, we don't want it to steal more.
Okay. Now, I've come across someone who doro rine zvarinobatsira pamoyo. I don't know, makambosanganawo nazvo here. And would you have any comment on that?
So what I've realized is that there are some things that are seemingly helpful, but our majority of us don't know the quantities that we're supposed to use when it comes to those things being helpful and aiding. You find most people who take alcohol, it's not to aid in digestion or aid in their cardiovascular system. No, they actually end up taking it in excess. So I'm always asking my patients who tell me that. I've come across patients who say, alcohol is good for my heart. And I just ask them, how much alcohol is good for your heart? How much of it? And they don't know. They don't know. So I'm like, so if you don't know, let's leave it.
Okay.
Right? Let's leave it. If you can't put a pin in it to say I'm going to stop here, then let's leave it. So there are some studies that do say alcohol is good for cardiovascular health, but how much alcohol?
Okay. Now, thank you for that. Now, Doc, we want to. Do you have anything else as far as liquid is concerned before we move to the next one?
I think as far as liquid is concerned, I think more and more water would do us more good.
Would do us more good. Okay, thank you. Now, we want to look at environment. The environment that we stay in or that we live in as far as the disease process is concerned. But we are not broadening it. We just want to narrow it down to non-communicable diseases.
So in terms of environment that we live in, it has a huge role to play in terms of communicable diseases, especially the quality of air that we breathe in. So most of the patients that I've seen that come in with lung malignancies or lung cancers or lung tumors are those that are from mining towns or a mining environment, meaning that they were in an environment that was polluted. They had air pollution for long periods of time, such that they now have this disease process, right, that's affecting their lungs. So also the people who come in with chronic airway obstructive diseases, you find that their environment had a huge role to play. So you find some of them are those people who've been using maybe coal, or the people who use firewood for cooking. So you find that those ones, because of the environment that they've been in, right? And then there are those that are unfortunate that they themselves do not smoke, but they live in an environment where someone smokes openly and they're around, they're what we call secondary smokers, right? They're also coming in with this lung malignancies. So you find environment is playing a huge role in cancers, and especially cancers of the lungs. And in
Okay.
terms also of maybe environment, those people, there's some who get skin cancers. Why? Because of too much UV light, right? So it speaks to the environment. Some environments receive more sunshine than others, and those that receive more and they're out in the sun unprotected for longer periods of time will come with those with skin malignancies. So from what I've seen, malignancies, cancers, are usually affected by environment. Yeah.
Okay, thank you. Now, here in Zimbabwe, do we have some people that get affected by sun exposure to the point of increasing their risk of skin cancers?
Yes, they are. They are. Not as much, but they're there. And it's actually worse if you've maybe used skin lightening creams before. So it
Okay.
makes the process even worse. That disease progression that we were talking about earlier, it makes it actually worse. And like I said earlier, that there are those who are out in the sun unprotected, right? So yeah, that speaks to environment. Yeah.
Okay. Now, I just want to go back a little bit. You mentioned those who use firewood, and sometimes nyaya dzemagetsi dzinogona kuti netse vanhu
For sure.
voshandisa either firewood or maybe charcoal, etc. How best can they improve their environment so that when they are using their fire, when they're using their charcoal, they reduce the risk?
Okay, so it would be good to ventilate the area in which we're working, and then also have those chimneys if we can,
Okay.
right? And then there's a protective wear for those who work in mines. There are certain types of masks that they can wear, and there's also those breaks that people can take to say, 1 week you're working, the next week you're not working, and then there are those regular checkups that they get. So you find that someone who has a non-communicable disease can get a superimposed infection, a communicable disease. So you find that those people should have regular checkups to say, oh, they don't have a TB that's worsening the non-communicable disease. So there are things that can be done.
Okay.
Yeah.
No, that's fine. Thank you so much. Now, what advice can you give someone who has not yet been exposed to any air pollution to the extent of probably causing disease or having relation to the causative of disease? What advice can you give to such?
I would say exercise in open air is a good thing. That sort of enhances your environmental factors. So it will help, and your lungs will thank you for it. So let's exercise in open air. And if we also have people who are living in environments where you have a smoker, it's good to ask them to smoke outside so that you're not exposed to the secondary smoking. And also the other thing, where we go in terms of environment. If you're going to go into a club where there's crossfire, when you're going to be caught in crossfire where there are people smoking everywhere, you're putting yourself at a risk because of the environment that you're choosing to be in. So we go back to choices to say, choose the places to which you go wisely. Yeah.
Okay, thank you. So the next letter, which should be the last letter we're going to look at today, is B, which is belief. People have got different beliefs.
For sure.
Beliefs about disease process, belief about the choices they're supposed to make. Have you observed any challenges as far as beliefs where they come in to actually worsen a certain disease?
I have. I have. One of the reasons for late presentation to a health facility is because of belief, unfortunately. So there's some that believe that the conventional way of doing medicine is not the right way.
Okay.
Right.
Can I conventional? What do you mean?
I would say maybe the clinics, the hospitals, the
Okay.
lifestyle centers, right? That's the norm, so to speak, is not okay.
Okay.
So they believe that staying home is the
Okay.
best way, and a denial of faith is going to someone else for help. So if I go and seek medical help, I'm denying my faith. Yeah, to say, I've said God cannot handle this, or whatever I believe in cannot handle this. So you find that they present late. You find that you ask a patient, when this wound was getting this big, where were you? And they start to say, they were in Chakadero, there was no money. And I'm thinking in my mind, no, but maybe this patient is an elderly patient, and they actually don't pay. But they did not come with the patient.
Okay.
So it's because of what that belief system to say, it's a denial of faith. And also some believe that they will not get adequate help, maybe because of past experiences. So maybe someone has presented to a health facility at some point in their life, and maybe they were not treated well, or treated as they expected to be treated, and now they believe at the back of their minds, all health professionals are the same, so that they're after this or that, and they make you go in circles, so they won't seek. So it's a belief that they hold dear, right? And then what I've found out about some non-communicable diseases, especially when we are speaking about mental health, some people think it's a gift. So you find that some people with mental health issues are gifted, right? In quotes. So some say, they're seeing visions. It's a gift. So if we present to a facility to say, sometimes they do have this gift, but they have odd behavior, right? That gift will be taken away from them. So it's also what is part of belief. Right, that affects how our patients are going to present, when they're going to present, or even if they're going to present. Right.
Thank you, Doc. Now, looking at the Seventh-day Adventist community, have you come across some patients who actually have got a certain belief that they think is correct, but in actual essence it's worsening their disease process?
Yes, I have come across some who have certain beliefs to say, I will do this, and only this is what will help me. And they forget that it's multimodal. Right? You can have several things that come into place. Like someone believing that only exercise will help cure my diabetes. Only exercise. But there's a lot more to it other than just exercise. So I've found people who hold on to one belief and they run with it. If they heard that maybe steaming is good for the face, they go with the steaming only. This is for lack of a better example. They're just steaming their face. Now to hydrate the face, or to put oil on the face, they're no longer doing that because they just think this is the way, and it's the only way. They don't explore, and they don't want to read, so that they educate themselves, so that they know more about something. So what I've realized is that if someone has a certain belief and they hold it dear, and they don't take time to study other alternatives, you'll be stuck with that patient because of their belief.
Still on belief, when it comes to prayer, have you seen prayer playing a pivotal role as far as disease process is concerned?
I have. So you find that people who pray or who believe in something, right, tend to do better than those that don't have. There are actually studies that prove this. So you find people who pray are happier people, right? And this helps in release of endorphins, and this helps sort of to a degree tone down inflammation, which we said is like the base of these non-communicable diseases. So you find that people who pray actually do better. People who pray are more optimistic, right? They've got a positive view on life. They think, oh, I'm going to get better. And their choices are also going to be better than, and also the way they implement things is also going to be better than those that don't pray or those that don't believe in anything.
Mazinzura Tereri, on top of the medication that is being prescribed to you, consider prayer. It's going to actually improve the outcomes as far as the disease is concerned. Better management, probably remission, and as well feeling happier, less inflammation, and much more. What are your last words to our viewers?
So for today, my last words are going to be ask questions. When you've got time with your healthcare provider, ask questions in terms of what more can I do besides just this prescription. And when you ask those questions and you get the answer, implement, implement, implement.
Celebrations Health reBalance. Today we had Dr. Linz who was sharing with us the disease process and how celebrations plays a pivotal role as far as checking in on the disease process. And I've got exciting news that I cannot leave without sharing with you. So Solusi University has come up with a very short course, and this short course is entitled Health and Medical Ministry. And in this particular course, its basis and its foundation is on celebrations throughout in clinical practice, how best to implement it in your home. So you can get in touch and get more details about this particular course that can help you to be able to have more information, become skilled, and have the tools on how best to implement celebrations in a more holistic and wholesome way. Because here, as we are discussing with the different interviewers, mainly we are just scratching on the surface. We cannot really go deep into some of the medical terms and processes. But I want to invite you to get in touch on +263 783 809 684, and I'll give you the details of the university, and you can get in touch with them and check with them how best you can enroll for this particular program. Until next time, please, as you are enjoying this program, click on the like button, on the subscribe button, and then share as well with others so that they can enjoy and have the benefits that you are getting today. Until next time, be of good health.